Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in our region. Mary Washington Healthcare is committed to improving the health of the people in our community. We take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share with you what we know about COVID-19 and what we are doing to help you stay safe and healthy. During this town hall, you will hear from our expert panel, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Doman, Chief Nursing Officer for Mary Washington Healthcare. And our third panelist is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. So Dr. McDermott, if you'd like to kick it off with our data and where things stand here in Fredericksburg.
Thank you, Lisa, and good evening, everybody. Thanks for taking a little bit of time again to join us for our Facebook Town Hall. I'm going to share with you some information about what's occurring here at Mary Washington Healthcare with COVID-19 and what's happening with our vaccination efforts. I'll start with the graphs that we've been showing every week and some good news with the continued great trend that we're seeing really over the past week or so. We currently have 59 patients hospitalized who are treating for COVID-19. That's down significantly from where we were a couple of weeks ago when we were talking about 99 or so patients within our hospitals. You can see, remember, the yellow line on that graph is our number of inpatients on any given day. You can see how that has fallen precipitously here over the past week. The orange line is the number of patients hospitalized in the state of Virginia, also on a significant downward trend. This trend we're seeing not just statewide, but also nationally. The number of patients hospitalized, the number of new patients diagnosed every day, the test positivity rates are starting to decline. And so that is really fantastic news. It's a little bit unexpected. I know just a few weeks ago, we were talking about bracing for really what we expected to be the worst times ahead of us. We typically are heading into what we experience as our peak flu season every year here in February and the first week of March. That's typically our peak flu season. Everybody kind of logically expected this would be our peak COVID season this year. But hey, we're following the real data, and the real data is showing we have a little bit of pressure being relieved from our system this week and less patients that require inpatient hospitalized care. We're also seeing less new patients test positive for COVID every single day here regionally and in the state, and that is good news. So probably multifactorial. I like to think it's because Chris, me, and Eileen have been here every week, stressing to our community how important it is to, stay home if at all possible, wear your masks indoors and outdoors, and social distance. But I'm not, we're seeing this trend is happening really nationally as well. So I don't think we can claim full responsibility for the trend, although, we like to think we play our part in that downward trend. And everybody out there is playing a part by following those tactics. We know that can keep everybody safe. We also, I think there's a lot of people wondering just how big an effect the vaccine is having. We vaccinated, it's close to twice as many people in the state of Virginia now have at least one dose of vaccine than have had COVID-19 from the beginning of the pandemic till now. I think that number is somewhere about 500,000 or so. We're closing in on 1 million people being vaccinated here in the Commonwealth of Virginia. So, that provides some level of increased immunity. And everybody, I know there's a lot of thought out there that at least we're nowhere near herd immunity and those things that you consider, but are we breaking the chain of transmission enough to be lowering the prevalence in our community? And that's an exciting thing if that's occurring. On the vaccine front, very proud of the work our team has put in for our vaccine clinic that we're running at our FIC Conference Center. For the last several days, really for the last week or more, when we're running that clinic, we are administering more than 2,000 vaccine doses a day. It's really pretty incredible. Everybody, the amount of feedback we're getting from our community, I'm so grateful for the feedback, but really I'm more grateful for our team of folks that have come together to put this together for our community, because it really is a shining star. It's a very efficient process when you're able to have a scheduled appointment to come in and come through our vaccine clinic. Our vaccine clinic is only by scheduled appointment. it's all appointment driven. I think that's another thing that leads to that smooth effort and throughput of the clinic, is because it's all done by appointment. So there's not a lot of queuing, and it's a very, very efficient process. I know I've used that term before, but it's a lot of the feedback we're getting is that it's more efficient than a Chick-fil-A drive-through, and that's a high bar of praise. And we're very thankful when members of our community compare us to the operational throughput of a Chick-fil-A drive-through, and being able to accomplish that by administering COVID vaccines is great. By the end of the weekend, we will have administered, Mary Washington Healthcare will have administered over 30,000 vaccine doses by the end of the weekend. And so that's we're pretty proud of that, pretty proud of standing up this vaccine clinic effort for the benefit of our community, and in playing that role. And so thank you to all the members of the team out there, driving that vaccine clinic and really providing that service for our community. It's an extraordinary effort and extraordinary results.
Thank you. We're already seeing tons of questions about the vaccine clinic and vaccines in general. So before we get to some of the specific ones, Dr. Newman, can you talk to us a little bit about the vaccines we're administering and what people can expect from the clinic?
Yeah, so right now we're administering the Pfizer and the Moderna vaccines, so the two vaccines that are currently available under emergency use authorization through the FDA. And, so you get one of the two. There's no picking, you don't choose. It's whatever we have on hand that we have been supplied at the time. And these are essentially equivalent, these vaccines. They work the same way, they have the same efficacy, they have the same safety profiles, essentially. So one is not better than the other. The slight difference between the two is one is given 21 days apart and one is given 28 days apart. And that's how these vaccines were just studied. So that's how we're following it and administering them. So you will drive in, you will register literally in a drive-through under the tent, and you'll be registered. And then when it is time for your appointment, you'll be notified via text, and then you come into the facility. And we do that for making sure that there's social distancing, safety of the number of people within the facilities. When you come in, you sign in. You very quickly and efficiently will get your vaccine. You get your vaccine card where they kind of write the lot number down and which type of vaccine you got, either Pfizer or Moderna. On your way out, you register for your follow-up appointment. So we do have the second doses on hand for you, and you will have a scheduled appointment upon leaving. So if it's Pfizer, it would be in 3 weeks, or Moderna within 4 weeks. You'll be monitored for about 15 minutes just to ensure there are no significant reactions to the vaccine, and then you can go home. So it's a pretty quick process, and people are getting really through and out really within a half an hour, and that's including the 15 minutes of monitoring. So it's really working very efficiently. I had the privilege today to vaccinate many of our community, and it really is an exciting thing to be able to do for our community. They're so appreciative. Our staff are so happy to be delivering hope in the arms of everybody as we kind of get out of this pandemic.
Thank you, Dr. Newman. And Eileen admits that hope with the numbers going down. We're going to be making some changes at the hospital. We've had restricted visitation for some time since last month or the month before, when our numbers really started climbing. So what are the changes that are coming?
Well, Lisa, the major change that we're going to be making tomorrow has to do with visitation. We want visitors to be in our hospital because we know that for someone that comes to our hospital for care, that can be scary. And we know that the most important part of their healing is to actually be able to have loved ones with them. We know that's a vital part of healing. And we've had to restrict our visitors back since about Christmas time. Now, at that time, we went to sort of what we're calling a red, yellow, green level of visitation. So we've been in the red level since about the winter holidays. And what that meant is that we've really limited no visitors in the hospital. And where that red, yellow, green visitation sort of system came from is we wanted to look at three things. We look at what is the prevalence of COVID in our community, because that tells us about everyone that's coming into our building, the potential risk of them bringing COVID in with them. We also want to look at the number of COVID positive patients that we have in our hospitals. And the third criteria we look at is our ICU capacity. How full are our ICUs? with COVID, but also just overall their capacity. And so what we see, based on what you heard Dr. McDermott talk about, is we've actually seen those numbers change. We've seen a drop in the prevalence in our community, those people testing positive. We've seen a drop in the number of patients that we have within our hospital that have COVID. And with that, we've also seen that drop in ICU capacity. So starting tomorrow, we will be reverting to our code yellow visitation. What that means, and all of this information will be updated on our website tomorrow, but what code yellow means for us is that we will be allowing one visitor per patient per hospital stay, meaning that we will ask patients to designate who that one person is that can come to visit while they're in the hospital. We'll be entering that information into their Epic chart so that when that person comes to the hospital each day to visit, we'll be able to check them in. Visitation hours are limited to 12 noon to 8 p.m. And again, so that's a way that we want you to be here with your loved one if they have to be in the hospital, but we're going to limit still the number of people that are in the hospital and the length of time that they're here. So by and large, for hospital inpatients, it's one visitor, same visitor through the whole hospital stay during the hours of 12 noon to 8 p.m. Now it's a little bit different if you're someone that's coming to us to have a baby. And so for those moms, we do allow up to 2 designated caregivers, and those can be 24/7 because babies don't know to arrive between 12 noon and 8 p.m. And then also for children. So for any of our patients that are under the age of 18, we will be allowing 2 parents or guardians to be able to be with their child 24/7. In our emergency departments, it will also be one visitor. And I also want to stress that when you are a visitor coming into our facilities, we're going to be asking you a couple of questions, and we really need your help to make sure that we're really doing a thorough screening. So you're going to be asked questions about if you've had COVID, if you've been ill, if you've been treated for COVID recently, if you've tested positive for COVID, or if anyone in your immediate household has tested positive. And just because, what we've learned is, while you may be asymptomatic, you could still be spreading COVID. And we want to make sure that we can keep everybody in our building safe, our patients, our visitors, and our staff, and our volunteers, and our medical staff. So we ask that our community work with us and be honest when you're answering those questions. We want you here with your loved ones, but we also need to balance that with keeping everyone safe. So again, starting tomorrow, 12 noon, we know what that means here. There'll be a line at the front door, but that's also something that makes us happy because that lets us know that loved ones are being able to be here with their patients, and that's important to us. So tomorrow, 12 noon, and more information will be on our website tomorrow morning.
Thank you, Eileen. I'm sure we'll get some questions, so I'll be back to ask you more. I'd like to start with some of the questions we're getting around the vaccine. There is a lot of frustration among our community who feel like they've been waiting a long time. They've registered on the websites that we've directed them to with the Rappahannock Area Health District or the Virginia Department of Health, and they haven't heard anything. What advice do we have to say to them, or what kind of encouragement can we offer them about their length of time they've been waiting to hear?
Well, I mean, I think we're all happy that there's so much interest in the vaccine, right? And that is great news. But there's limited availability at this point in time. And I know our health district is dependent on allocations from the state. Our state is dependent on allocations from the federal government. And so there's only so much supply coming in. And so I know, working with our health district, we are working with them on the list of the eligible individuals that have registered at this point in time. That includes some subcategories, the 1A category of healthcare workforce, the 1B category that includes some other essential workers, school teachers, and some other categories, as well as those individuals 65 and older and 16 to 64 with kind of a complicating medical condition. And so from those individuals that have registered with the health department, we are working through those lists and making our scheduled appointments available to them to get the vaccine into as many members of our community that are eligible as possible. And so unfortunately, there is a sequence and everybody needs to be a little patient based on how much vaccine that we have available in our community at this point in time. And so we are working those lists of the individuals that have voiced that they're interested in receiving the vaccine. And hopefully we can get through everybody who wants a vaccine as quickly as possible. I know the federal government is working on sourcing more vaccine and making sure it's available as quickly as possible to every citizen of the United States and every member of our communities who's interested in being vaccinated.
Well, you know, Mike, all three of us have worked at vaccine clinics, and I worked at a clinic last Friday. And I have to say that I asked people that I was vaccinating how they got their appointment. And almost every single one of them said they had gotten a phone call from the health department. So I know if your name's on the list and you haven't gotten a call, it can feel like, well, maybe the list isn't working. But I can tell you that was different from the time before when I'd given vaccine, is that people hadn't gotten a phone call. But I definitely noticed that difference last Friday. So I think it's just that there's a lot of people that want it, and we want them to get it as quickly as possible, but the list is being used.
And the last numbers I heard, there's the list through the health department is upwards of 40,000 individuals. And currently our health district is being allocated just over 4,000 doses a week. So you just have to add that up. If you're waiting 2, 3, 4 weeks, that's not to be unexpected. Wish we could do better than that. And I think Mary Washington's commitment is to work with the health department. As much vaccine as we get, we are going to give as rapidly as possible to protect our community. We are committed to that. One other area of optimism is, there's another vaccine now potentially coming to the FDA for emergency use authorization. I did just briefly hear today that Johnson & Johnson's vaccine is going for approval. So that could be an additional vaccine that comes onto the market and can additionally increase the supply. So don't lose hope. I do think we're getting there. And the federal government's working very hard to increase the supply and then subsequent allocation to the states as well. But I understand the frustrations. Many people that I saw today had, very significant health concerns, and they have been waiting for weeks, and they were really thrilled to be able to have the opportunity to get it. But I wish we could vaccinate everybody this week, but it is going to take some time.
And we have had some viewers express concern that there might be some shadiness in how people are getting their vaccine. Is there any kind of favoritism happening that employees or employees' families and friends are getting vaccine over those that are on the RAHD list?
No, we're working through the list with the Rappahannock Area Health District, including the 1A group. That includes not just the healthcare workers that are part of our Mary Washington healthcare team, but all the other medical practices and dental practices and practitioners of healthcare within our community are on that 1A list, and all the employees that work in those essential healthcare businesses. So they're eligible, like they're in the 1A group when they want to get vaccinated. And then the 1B group is broad, right? It's a broad group right now. When the governor broadened and said, hey, we're not just in the 1A group, we're moving into 1B. And 1B includes individuals 65 years of age and older, and anybody 16 to 64 with the CDC calls, what could be a complicating medical condition that they have that puts them at high risk for having a bad outcome with COVID-19. So there's a lot of eligible individuals. And so, we're following those lists along with the health department to get those eligible individuals vaccinated.
Thank you. And what kind of side effects can someone expect from the first shot and the second shot?
Yeah, interestingly enough, the CDC has been following this, and finally there's some formal information on this with a little more statistical analysis of this. So the first shot, the symptoms and the side effects are pretty minimal for most people. The side effects generally occur for the people that are going to occur more likely after the second dose of the vaccine. And from what I saw with the CDC's initial data was compiling that about 25% of individuals will have fever, chills, body aches, and headache after the second dose. It was something on, if I'm recalling correctly, on the order of 6 or 7% after the first dose. So the vast majority of people, you have to realize, and 75% of people are really having minimal to no side effects. And for those that are getting side effects, again, this is not an adverse reaction to the vaccine. This is your body's immune system mounting a response. When you get sick or have the flu, the fever is not necessarily from the virus, it's from your body's immune system attacking that virus or building up that response. that cytokine response. And that is what's happening. It appears to be more frequent in people under the age of 50. They do get a slightly more robust immune response, particularly after the second dose. It really just shows the vaccine is working. And people who don't have any side effects don't need to worry, oh, the vaccine didn't work for me. That's not how this works. We're seeing upwards of 94% of people having a very significant immune response, whether you had side effects or not. And I think I disclosed last week, I did have, significant side effects. It was fever and chills for about 9 hours. And the next day I did have some significant fatigue, but it's alleviated with fluids and ibuprofen and Tylenol. And by no means would I not sign up to do it again. I would not change my mind. This is, a life-saving vaccine. This is going to allow us to all get back to normal life. And when we see now reports of people who've had COVID and are having long protracted issues with chronic fatigue and memory difficulties and cardiac issues and, potential strokes. And, we think about that acute phase and coming to the hospital, but there are these quote unquote long haulers, and we don't really understand that. Don't put yourself at risk for that. A few hours of fever is certainly much better than getting COVID.
Thank you. And can we talk a little bit again about the sign-up process for the vaccine? A lot of our community members are still confused because just a few weeks ago, we were able to open appointments, and we've shifted to working directly with the Rappahannock Health Department to change the tactic of how people get invited to receive the vaccine. So can you talk a little bit about what they should do to ensure that they're on that list for the vaccine?
Yeah, and I can appreciate the confusion that members of the community have had as this has got rolled out, and it has not been perfect because there's a we're getting better as we work through this every single day, I would say, and so we're learning more. We are committed to work with our health department on that list of individuals that have signed up. Last week there was a push by the state to administer vaccines and the inventories that were on hand in a very, very efficient manner. They said, hey, come on, we got to get this thing kicked into gear. And we had just built our clinic. And so we were making commitments to the state saying, hey, we think we can do this. And we weren't able to follow that list from the Rappahannock Area Health District perfectly, I would say. We were trying to make a commitment to our community to vaccinate 2,000 people in a day. And we weren't able to work on that list to fill those appointment slots. And so there was a point in time, I would call these very short segments of time, where we opened appointment slots on our website so that we could vaccinate members of our community who were eligible for the vaccine, right? They meet the criteria of being either 1A or the 1B groups that the governor has designated that are eligible for the vaccine. But we wanted to open those appointments so we could not lag behind the administration of vaccine and use all the capacity we have to vaccinate on those days. We've gotten better now at working the list with the Rappahannock Area Health District and making sure we're reaching out by email and phone to those individuals to pre-fill the days that we have vaccine available. And so the appointments have not been as available on our website recently because we're filling the appointments through the list of folks who have signed up with the health district, which is how we want to approach this. And so that's working pretty well right now, and it's the tactic that we're taking. So if you are interested in receiving the vaccine, make sure that you're on the health department sign-up list. That's the list that we're working together to get those members of our community that have voiced their interest to make sure that they can get the vaccine.
Thank you. And there's a few questions here of concern about that second dose availability. Specifically, people have said they've had their shot with Mary Washington. Will their second shot still be there waiting? And they continue to hear talks about increasing vaccinations by using the second shot as a first dose. And in other countries, they've done some things regarding one dose efficacy. So are we hearing anything like that, either regionally or throughout the US yet here?
Yeah, I don't think there's any intention I've heard in the state of Virginia for one dose efficacy sort of maneuvers, right? And they're intending every single individual that gets a first dose, there'll be a second dose available. There are logistics involved in that though, right? Where those doses are needed until 3 weeks later. And so there's shipping schedules and things so there are planned second doses for every first dose. That's the best way to say it, and full intentions and scheduled slots and already appointments made. When you get your first dose, you have a scheduled appointment for the second dose. And so all of those plans and logistics are in place to be able to deliver on those.
Yeah. And what is the timing? Is it safe to potentially get that second dose a few days early or a few days late?
Yes, so it does not have to be exact. And just sort of understanding how cellular immunity works, and I don't expect those that are listening to truly understand that, but there should not really be much of a difference if you're a few days on either end, or even a week, quite honestly, late on the vaccine. It should work just as well. You just have to remember it takes about a week after you receive your second dose to get full efficacy, to get up to that 94% protection. But if you miss the appointment and you're a few days late, you didn't miss your window. Although from just an operational standpoint, we really want to do this efficiently. We do encourage people to make their appointment when they get their first dose and keep that second appointment. We're running thousands of people through this clinic. Don't miss your shot. So, it's really critically important for you, and it's a difficult thing to run operationally. So, we do encourage people to schedule when they leave and keep that appointment.
Thank you. And a lot of questions also about, gosh, are we ever going to get more vaccine than what's been promised? You've talked about it a little earlier, Dr. McDermott, about the volumes that are coming into the state from the federal government and coming to our region based on the population. Is there talk of ramping up production? Is that happening?
Yes, that is happening. I know that's already happening with Pfizer and Moderna. And like Chris said, we're likely to have Johnson & Johnson, AstraZeneca, and other vaccines available in a relatively short time frame. And so that increases availability of vaccines as well. And, I fully expect in the coming weeks to have vaccine available in more locations over the coming weeks. And that I think is very good news, right? The more distributed this is, the more access points, the more everybody's pitching in to vaccinate everybody in our community, whether it's at pharmacies and other methods of doing that. That's all very, very good. And so I do expect vaccine availability to improve as we go through the forward weeks. There was the initial inventory available when the vaccine got approved, and then the standard production. And I know they're ramping up that production, and more vaccines are likely to become available. So I think when you look at that forecast, my forecast is there's going to be more vaccine availability in the coming weeks. That's good news, because it means more of us can get vaccinated quicker.
Thank you. And what do we know about these new strains? Are we seeing it here in our area, and how are the vaccines effective with those new strains?
We're learning more and more about these new strains every day. Most of these strains do appear to have a higher infection rate or higher transmissibility than the first wave of COVID. So that is a concern. Really, we don't know much about the severity of illness, caused by this. It appears to be roughly the same, but it's difficult sometimes to extrapolate some of that information. Some of the preliminary research on this has shown that the vaccine does give protection for most of, if not all of these strains to some extent, but not up to that 94%. So there is a chance that there could be boosters, coming down the road to look at some of these strains, such as Moderna, I've heard is looking at that, and others. So I think a lot is still unknown about that. So we're not completely out of the woods yet. I do know that decreasing the transmission of COVID right now by getting everybody vaccinated as quickly as possible will decrease the ability for the virus to mutate, and will decrease the transmission of these mutant strains. So really, rapid vaccination with our current vaccines that we have is the best step in preventing this. And the answer is yes, most of these are already in the United States. We have to assume they're in our communities. I would not, rely on that. We're not testing. I think I saw somewhere about US is testing 1% of tests for, these particular strains. So, but they've all been definitely found in the United States. But the issue is how much, and are they here? You just have to assume they are. We're not testing for these particular strains. It's another reason, as Mike always says, the social distancing, the masking, protect yourself until you can get the vaccine. And even then, it's not life as normal. You do have to continue with some of these parameters even when you're vaccinated.
Thank you. And someone is asking if it's worth for someone who maybe is under 50 with chronic lung issues to consider getting the vaccine. Do you have to worry about shortness of breath or wheezing as some of the side effects?
No, in fact, you're a prime candidate for getting the vaccine. We'd be very worried that if you got COVID, it could be a very severe illness and lead you to the hospital or worse. So definitely do not delay. When you have the ability to get the vaccine, do not hesitate to do so.
I mean, you can't get COVID from the vaccine. And so symptoms like shortness of breath and things like that are not the typical symptoms of an immune response, right? It's really, I feel a little achy, I got fever. Those are the symptoms of an immune response, not the shortness of breath. That's a symptom that people with COVID get because of the infection in their lungs from the coronavirus. And so it's why it's so important if somebody does have a lung condition like that, get vaccinated to protect yourself. If you got COVID, you could have a very, very bad outcome from having COVID-19. So make sure you get vaccinated and protect yourself.
Yeah, the positivity rate in our community is still over 10%. I think we hit the week at 15%, and I think it's probably trailing down. Don't have the number from today. The chance of having a serious reaction to these vaccines is 1 in millions. So there's no comparison on an odds game. It's not even close. It's amazing how safe. We're so lucky to have these safe vaccines at our disposal at this point. But the anaphylaxis, that significant allergic reaction, is literally 1 in millions of doses. And that's a treatable condition. We're monitoring individuals here. We have the capability of treating it if you should have any signs or symptoms of that. So there really should be very few reasons anybody would be concerned about proceeding with vaccination.
Have we seen anyone reporting side effects a week or two after getting the first or second dose? Is that typical?
No, most of the side effects are generally, the worst is 2 to 3 days, generally after the second dose. That is really the longest that I'm hearing attributed to the vaccine. Usually the fever and chills last a matter of hours to a day afterwards, if you get that even. And then fatigue and headache, I've heard individuals talk about for a couple days thereafter, but generally, like I said, for myself personally, within 48 hours, I was back to completely normal. And that seems to be the case for most people. I think the longest I heard anybody, at least within our health system that I talked to, have side effects was 3 days. And it gets mild, it's self-limited. They were able to come to work. I mean, you take Tylenol, Motrin, those kind of things. So again, none of this should dissuade anybody from getting the vaccine. COVID is far worse if you get COVID.
And most folks don't have side effects.
Yeah, most people don't have it. Right?
Most people don't have side effects. So,
Yeah.
So if people are experiencing things like anxiety or chest tightening or dizziness or nausea 2 weeks after their vaccine, you should not be attributing that to the
Do
vaccine.
not attribute that to the vaccine. Yeah.
I know people like to do that, but it's not the vaccine.
No,
Yeah.
they need to maybe see their doctor.
Yeah.
Okay. So we had a couple of testing questions. The first one, are we testing for flu and COVID? Is given the time of year, are we doing testing on all of those?
So we have a test that does test for multiple respiratory viruses right now, 4 different respiratory viruses, including COVID, including flu, including something called RSV. We are doing that on certain patients. That's not the standard test we're doing for every single person coming into the health system, but we are doing a significant amount of testing for flu with that quadrivalent test. We've not seen a lot of flu, and that's not a surprise to me. I kind of predicted that even before hitting the flu season. All the masking, the social distancing, all those kind of things obviously would prevent flu. COVID is 3 times as contagious as flu. So that's, all these methods are really helping the flu, which is far less contagious than COVID. Plus, a lot of people got the flu vaccine, which we're grateful for. Because of the pandemic, I think we saw increased flu vaccinations, and that's all great. And I hope that continues long after this pandemic.
Thank you. We had a clarifying question on why we're not testing every patient prior to hospitalization or procedure.
It it's a decision that we've made on and off, and it's based on many different things. It's based upon our ability or supply of testing, which throughout this whole pandemic has not always been ubiquitous. Right now, we do have some pretty good testing capability at our health system, which is great. So we are testing a large majority of people coming in. Those undergoing low-risk procedures, particularly some of the outpatient procedures, given the prevalence in the community and given our safety protocols, it may not be necessary for an asymptomatic individual. But anybody with symptoms, we are able to test, and often with a rapid test, not even one that you have to wait. And most significant surgeries, we do have a list of higher risk procedures and surgeries. We are testing and having results within a day. So that test can be done very close to the time of your procedure. We have rapid antigen testing at our urgent cares and our primary cares. So we have a lot of testing capabilities at this point, and we are testing most everybody that would require a test.
Thank you. And what about with the vaccine? If somebody is asymptomatic and has COVID and doesn't know it, and they receive the vaccine, will that make their infection worse or impact them in any way?
No, in fact, they did not test for COVID when they did the vaccine trials. So it is quite understandable that people could have had asymptomatic COVID who were involved in the COVID trials. So the vaccine really doesn't start building your body's immunity after the first dose until about 10 to 14 days afterwards, and then you're only getting about 50% of the immune revved up response and efficacy. So if you have COVID, it's really not going to change the course. Getting a vaccine really won't change the course of your illness at that point. So don't come for a vaccine if you know you have COVID. Don't put everybody else at risk. It won't help you. But if you have asymptomatic COVID, that's not a reason to worry about the vaccine. And right now we're largely because of the supply of vaccine, we're telling people who are 90 days within their COVID diagnosis who likely have immunity to COVID to delay so other individuals can get the vaccine ahead of them who have no immunity. But from a safety standpoint, it probably is safe to get the vaccine, easily 30 days and maybe even sooner if you're asymptomatic or haven't had any, or your symptoms have resolved.
Thank you. Will Mary Washington Healthcare be connected with CVS and Walmart now that they've announced that they are getting vaccines as well?
Will we be connected with them?
Is it going to be in any way connected?
I don't believe so. I do know with the state, everybody who gets distributed vaccine has to report into a state system of the administration of that vaccine. And there's that's what's driving daily the updates on the Virginia Department of Health website about how many people in Virginia have been vaccinated, how many vaccines have been distributed, and all those statistics are being driven by those reporting systems and the interfaces that are required. But the coordination between the individual pharmacies and all that, it's not likely to happen to be coordinated through our health system in any way.
Okay. And there's still more questions coming in after we've already answered this. So I'd like to come back to it, but clarity on their best course of action right now would be someone who wants the vaccine is to register with the Rappahannock Area Health Department, correct? Or their local health district.
That's correct.
And there were some questions about why some people got invitations from us, and it was one spouse got the invitation and the other spouse who also registered haven't gotten the invitation yet.
I'm not sure I can
answer that.
Yeah, go ahead, Lisa.
I can answer that one because I am one of the ones sending out those invitations. We are getting partial lists from the health department. We don't have the entire list from the health department, so we can't clear up for our viewers where they are in the queue because the health department is working with many partners to get the vaccines out. They are sharing the list so that we're not duplicating efforts. We already know that sometimes people might get an invitation when they've already received the vaccination somewhere else. And so they get a little frustrated, like, why are you sending me an invite when I just got my shot last week? And that's because it's taking a village of coordination to get these lists out. So we're trying to avoid duplication, but we can't help that. So we don't have a complete list of the 40,000 people. We're given invitations for the amount of vaccine that we're distributed each week. We don't want to over schedule and not have the vaccine. We only schedule up to the vaccine that we have on hand.
That's one thing I think that is important, and it hasn't happened universally throughout even the Commonwealth of Virginia. There are some that were scheduling appointments, assuming they were going to have vaccine available. We don't do that. Like, we're not opening appointments unless we know we have vaccine here for those first doses and we can administer it in this time period. And so when you have your vaccine appointment, we have the vaccine for you, but we're not scheduling like 3 weeks in advance appointments because we don't know what exact vaccine we're going to have at that point in time, or if we're going to have it. And so I think that's a good thing that we're doing here. We're being very tactical. I can't even forecast out exactly 3 weeks from now how much vaccine we will have in that week. I don't know. And so we're waiting until we have it, that reality of what we do have in a given point of time to administer, to open the appointments and get some individuals vaccinated. So I think some people might be comforted saying like, man, at least I wish I knew I had an appointment in the end of March, then I know, but that would just be a promise on something we don't know we have yet. And so we're not doing that, but we will be scheduling and administering vaccine as we have it available to us, and scheduling those appointments when we have the vaccine here.
Thank you. And Dr. Newman, how soon after your second shot did you start feeling those symptoms you were talking about earlier?
So me personally, it was probably about 15, 16 hours after. My symptoms lasted for about 9 hours of the fever and chills, and then a fatigue for about another day, and then I was fine. Most people I've talked to, it's somewhere in that 12 to 18 hour range is when the symptoms, if you're going to get them, do occur. And again, you know, Tylenol, Motrin, fluids, those are the things that you can do to kind of alleviate them pretty quickly.
I had your same symptoms, and
Yeah, there you go.
my fever, I was congratulating myself for building my immunity.
There you go.
I had no symptoms.
You had no symptoms? Oh,
Yeah.
we're lucky. Well, see, there you go. We're
lucky.
a microcosm of the reality of everything. There's some of us with and some of us without, but we all are grateful for having the access to the vaccine. So we're getting some very specific questions, and I'm going to ask. I am not a clinical person, so I might butcher some of these questions. So I apologize to our clinicians on the panel if I do that. The first is, can patients with Guillain-Barré syndrome, is that how you say it?
Guillain-Barré. Guillain-Barré, yeah.
Can they receive this vaccine?
Yeah. So Guillain-Barré is a condition where your body's immune system attacks the nerves and can cause a pretty significant reaction. So this traditionally occurs not after a vaccine, but after a virus. So you could get a virus and then a week later come down with this symptom called Guillain-Barré. Thankfully, it's rare. It's not a very common kind of condition, although it does happen. There is some concern because vaccines create an immune response, and there is concern in individuals who've had this about could it happen. My answer is always to probably confer with your physician and treating physician. There is no definitive contraindication to getting the COVID vaccine if you've had Guillain-Barré. But that being said, again, thankfully it's a very rare condition, but if you have had it happen to you, it can be concerning. So I would discuss risks and benefits with your physician in that case.
I mean, many millions of doses of these vaccines administered now, and I haven't heard a lot about Guillain-Barré.
No, I haven't heard of a single case from the COVID vaccine, quite honestly. So, it's more theoretical than it is actual. So, and again, the risk of COVID is high. Like I said, 15% testing positivity in our community this week, and the risk of Guillain-Barré is extremely rare. So, there are risks and benefits to everything. But
thank you. And this one I can pronounce. What is it effective and safe for pregnant women?
A lot of debate on that. Not really that it's unsafe. It's just that it was not studied very readily. So I believe I heard there were something like 13 or 14 women in the vaccine trial that got pregnant while they were in the midst of the trial, and there were no significant outcomes. I know the American College of Gynecology and Obstetrics and Gynecology did promote the vaccine. This is one of those kind of things where you have to kind of weigh your personal risks and benefits, maybe with your physician. Certainly after you deliver, get the COVID vaccine. There should be no question then. It does appear to be, safe in pregnancy, but anything that's not been studied in that way, we can't definitively state that. So what I've seen a lot of medical societies saying is if you have a high risk, you're out there in the community, you have a high risk, or you have other high risk conditions, you would lean towards getting the vaccine. And if you don't, and you can kind of stay semi-quarantined in your home during your pregnancy, then you may opt to delay.
Okay, thank you. And with this one question, the viewer is asking about the mRNA vaccines having a quote, hairpin loop in them. And is this something we should all be concerned about?
No.
Okay.
The way these vaccines work, it's not a complete virus. It's in essence a message that is given to your body, a set of instructions to build an immune response and a defense. And then that defense is in your body. And when the vaccine shows up, your body's ready to say, get out of here, right? And the vaccine can't take hold. The virus can't take hold. And so, no, the set of instructions to produce the antibodies, there's nothing about a harpoon loop that's dangerous or anything like that, right? It's just an instruction set. Your body produces the antibodies. They're in your body. If the virus shows up, they're there to knock it out before it takes hold. That's long story short. It's not a complete virus. It's just a little instruction set that gets your body ready to produce. It makes your body produce those antibodies.
Thank you for that explanation. And do we feel that it's going to be safe to get the vaccine at the pharmacies and other locations that are starting to distribute?
Yeah, they distribute lots of vaccines for lots of different. There's lots of viruses that exist in the world that we have herd immunity to, right? Things like measles and chickenpox and all these things that we don't spend a lot of time when we walk out the door every day wondering if I'm going to get the measles today, because we have herd immunity. We built those up through vaccine-mediated herd immunity, right? And so many of those vaccines are administered at pharmacies and doctors' offices and all those things, and they're very capable of administering the vaccines. And I think all of us hope very, very quickly that these vaccines are available in such a way that they're abundant and that they're present in all those locations and everybody can get vaccinated in those locations. Some of these early vaccines, the Pfizer and Moderna ones, do have storage requirements and shipping requirements that are a little bit more difficult than standard vaccines that we've had. And so that makes the logistics a little bit harder, but they are manageable, and there's nothing about these vaccines that can't be managed with pharmacists at pharmacies. It's kind of technically what they do. It's our pharmacists here at Mary Washington Healthcare that are helping us manage these vaccines here in our system. So I do think, there is the opportunity once these are readily available for pretty widespread distribution of the vaccines in a very safe way.
And is our vaccine clinic running at full capacity, or are we constrained by the availability of vaccine?
I think for what we've built at the FIC Conference Center and the physical footprint of that facility, that it is running at full capacity on the days that we are running it. And we typically been running it 12 plus hours a day to get those 2,000 individuals through there. And so I think for what we have operationalized and built at this point in time, we are running it at full capacity the days we're doing it when we have that vaccine available. And I don't like to forecast out because I don't know exactly what the vaccine availability is going to look like in the coming weeks. I just don't know if we're going to be able to run our FIC Center clinic 1, 2, 3, or 4 days a week, 5 days a week. I don't know. But if we have the vaccine, we're making a commitment here that we want to get it into individuals in our community as quickly as possible. And we're partnering with the Rappahannock Area Health District and trying to do that in as coordinated a fashion as we can.
Thank you. And many of our viewers, we've seen this occasionally here in the vaccine clinic, are getting other vaccines about now. Shingles vaccines, pneumonia vaccines, things of that nature, maybe a booster if they go to their well visit with their doctor. Should they delay the COVID vaccine when they are scheduling other vaccines, such as shingles or something like that?
I think there's a loose recommendation saying you should schedule them about 2 weeks apart from one another. I don't think that's a perfect recommendation, but that's the general recommendation is, your body's building an immune response to each one of those vaccines. And so spacing them approximately 2 weeks apart is the general recommendation.
Okay. And what happens if we run out of vaccine appointments and we haven't completely satisfied our list? Are we putting people back into that list to re-invite and hold until they're available? Or are they going back to the health department? How are we working that list? I can answer that.
Yeah, maybe you answer that one.
I could take that one. I actually have answers this time. We actually are recycling the list until we have exhausted the list to ensure that people have gotten that appointment. But we continue to add each time, because obviously as people come in to get their vaccine, the list is getting smaller. And that's one of those systems that Dr. McDermott mentioned before that we are trying to perfect. And we are learning every day how to make it better and better. And hopefully you'll see even more improvement for those that are receiving invitations, that it gets better and better each time.
I know there are folks working on this at the state level. Even I know the governor's talked about it at his press conferences about, continuing to modify and improve the way individuals can sign up for that and having better feedback and all those mechanisms. And so I think everybody's working on that, everybody has a commitment to try and continuously improve the system and get better with it as we move forward.
And we're getting a lot of questions of very specific issues, medical conditions somebody might have and whether it's safe. What advice do you give to people with a medical condition about whether they can get the vaccine or not?
You always want to just obtain the advice of your physician. There are just many very specific situations, so it's hard to answer them all. One condition that came about that people want to delay the vaccine. If you're going to get high dose steroids as part of a chemotherapy regimen or part of something, some other procedure, because that may, not that it's dangerous, but it may blunt the immune response when you get the vaccine, and you want to get that immune response. So there are these little specific things that maybe if you're under treatment for a significant medical condition, always confer with your physician and discuss it with them. Our medical community is discussing these things on a regular basis, and we're learning more and trying to keep up with the literature. But on just a very high level, most people who have significant medical conditions, those are the individuals we want to get vaccinated. Those are the people who are most likely to go on to require hospitalization or have even death from COVID. So those are the people we want to be protected, but very specific situations, always best to confer with your physician.
Okay, and we are getting some questions about how long is this going to take? They've seen reports that it's going to take 5 years or more to get 80% of the US vaccinated. And how soon could we be talking about breaking down social distancing and wearing masks and all the things that we're trying to do to stay safe?
I mean, there's lots of projections out there, and this is the thing that it's uncertain here because we're making projections currently based on the fact that we have 2 vaccines approved through their EUA. But like Chris was saying, that's likely to change I think in the relatively short term from some of the preliminary data that we're seeing, if it holds up through that scrutiny of the FDA. And so as more vaccines are available, obviously all those projections change and the numbers move, the time moves shorter that we have everybody who wants a vaccine having the opportunity to get a vaccine. So hard to predict. Most of the things I've seen are sometime in the summer. There will be availability and enough administration and all those sorts of things where everybody who wants a vaccine will have had an opportunity to get it. And we reached maybe that point in time where the transmissibility chain has been significantly broken and we approach something that might look like herd immunity, where then we could, as a society, kind of get back to what we would consider to be normal in some sense, where we're not always wearing masks and having to do those other tactics to keep us safe. So I think a lot of people now are pointing towards the summertime. A lot of the projections that I see as they draw out those curves and start to plot transmissibility and immunity and all those things, a lot of them have points of time in the summer time frame that we would be looking towards. But that can all change as more vaccines become available. That could slide forward. Obviously, it could slide the other way too. We don't know that perfect time now, but I think those are most of the projections I'm seeing.
I think the big variables that make this very difficult to say is the availability of vaccines. So how quickly can we vaccinate and protect somebody? And then, the mutations and the mutant strains, the prominence of those or what those hold. So it is going to be a little bit of balance between them, but the optimistic is this summer. So, we're not looking super far out. I'm hoping that this summer, but I saw a quote by, I think it was Yogi Berra, the future sure ain't what it used to be. And, I think that's a good quote for this time. None of us have predicted this perfectly from the beginning. And I think there's just, we have to be, comfortable with some of the uncertainty. I think we talked about that back in last spring when this was all hitting, is just having to embrace that uncertainty. But we need to do what we can. We need to continue the social distancing. We need to vaccinate people as quickly as possible. And that's the way we can tamp this down and get back to life as close to normal as we can get it.
And as we get towards the end of our hour here, we have decided that our weekly town halls maybe don't need to be as weekly. So Dr. McDermott, if you could talk about where we've been and where we're going with our town halls.
Yeah, so as we shared first when we started the town hall, looking at some of our data, things sure look to have stabilized a bit in our health system, right? And so we ramped back up these town halls to raise awareness in our community about what we were seeing with COVID, the pressure it was putting on our health system. We've all followed that together over the past weeks as it's been on a constant upward trend line, but now that trend line seems to have broken. We have flattened the curve again, and it's trending in a positive direction. So some of that pressure and relief is now welcome in our health system. And so we feel like maybe we can pause these town halls from now. The vaccination efforts are well underway, and I encourage everybody in the community to make sure that you signed up with the Rappahannock Area Health District, your interest in receiving the vaccine. Also, I would keep paying attention to the Virginia Department of Health and any optimizations they might be making in that sign-up process as we move forward and as more vaccines become available. Because as more vaccines become available, your access points to receive a vaccine are likely to increase as time moves on and there is more vaccine availability. And that's a good thing for everybody. The more points that we have where people can receive the vaccine closer to home, that's great for everybody. And so we're looking forward to that. I do encourage everybody, though, at this point in time, we need to stay vigilant. And I know I've been kind of the Grinch here as we've gone from before Thanksgiving, and I'm telling everybody, don't meet with your family for Thanksgiving, right? I'm delivering bad news all the time. Same thing, we head into Christmas, and I'm saying, don't get together with your families. Make this a different Christmas. I'm like the Grinch. And here we are. We have Super Bowl Sunday coming up this Sunday. And it's a very, very another dangerous, I consider it a potentially dangerous event when people traditionally love to get together with individuals in their neighborhoods and friends and celebrate the Super Bowl, right? And we have to be careful doing that right now. This coronavirus is still very, very prevalent, right? The trend is going in the right direction. We need to stay vigilant. And so, my wife, Chrissy, and I, we have a recipe for some pretzels we're going to make and a corn dip, and we're excited. And we're going to watch the Super Bowl with our dogs, and maybe we'll FaceTime with our family at various points of the game. But that's it. It's just going to be us watching the Super Bowl, and it's going to be great. And so I encourage everybody out there who's listening to make similar plans. Right now is not the time to be reckless or take a chance. We have this curve going in the right direction. Let's keep it up, man. Let's stuff it out here. And so, stay home for the Super Bowl. Enjoy the game. It's going to be a great game. Everybody can enjoy it. Call your friends and spend a little time with them over technology during the game if you need to or want to. But when you do need to leave your house, make sure you're still wearing your mask right now. Social distance, exceptional hand hygiene, all of these things have played a part in helping us to flatten the curve. And so thank you everybody for your efforts.
Thank you. And thank you to all of you for continuing to join me every week as we share this information with our community. And thank you to the community for their continued support. We're getting tons of love right now on our Facebook page of people who are grateful for their opportunity for the vaccine, grateful for all we've been doing and our transparency. And I'd like to give a shout out to one viewer who has designated that they are going to be tough like Dr. McDermott when they get their second shot. So everybody out there needs to be tough like Dr. McDermott and get their vaccine, both shots, regardless of the side effects, and wonderful things. We do invite all of our viewers to continue to connect with us through social media and through our call centers. We have call centers set up to help you with your symptoms. We have call centers to help you with finding providers if you don't have a doctor. We have urgent care facilities if you need testing. And the Rappahannock Area Health Department has been a great partner and continue to provide free testing in our community and support the vaccination process here for Fredericksburg region. If you are experiencing symptoms, we know that 15% of our community still are testing positive for COVID. So if you are experiencing symptoms, you can always call our HealthLink nurse triage line at 741-1000 to talk to one of our nurses and get some advice on where you should seek care. And just a reminder, the Rappahannock Area Health District is hosting free testing this month, and check their website regularly, even going into next month, if you have symptoms and you'd like to get a free test for COVID-19. And as we continue through the winter season, we ask that you please stay safe and healthy and have a good night.
Thanks, everyone.